Hello and welcome to our post-summit update. So I am Shannon Studden, a Senior Program Specialist with the National Rural Health Resource Center and a member of the center's team for this project. I would really like to start by thanking you for joining today and also just to express sincere gratitude for your participation and your engagement in our project this summer. We know it's been a very difficult spring, a very different spring and summer with the COVID-19 pandemic, and we know that it's taken a lot of extra effort for you to participate in our study of trends and disruptors, officially titled Trends and Disruptors in Rural Minnesota Healthcare 2020 to 2030. We've asked a lot of you, your time and your energy in preparing for and fully engaging in the summit, and then thinking through and sharing your insights in the form of recommendations. So what we'd like to do with this presentation is just to provide you with a brief update on what we've been doing with all the information and the insights that you shared with us in June, and also just to get you reoriented on the project before we meet next week to have some conversation with each other for the last phase of this project. And this presentation should last about 15 minutes. So just a quick look at the agenda for this presentation. We'll start with just an overview of the project. The project's a little bit complex, so I'll be taking a couple minutes to walk through the design, what we've been asking you to do and think about and share, and how we're using your insights to develop the project's final deliverable, which is a finding and recommendations report. So I'll be presenting highlights from the June 24th and 25th summit that you participated in. We've been very focused on analyzing the summit results and are looking forward to sharing these results with you today. We just would really like you to see the incredible contribution that you've made to this study and to this project. I'm also going to give a brief introduction of what's coming next as the project team continues to develop a model from our case study communities. If you remember our Alphaville, Bravo Prairie, Charlie Pines, and Delta Lake, what those four communities might look like in 2030, given the vision for our rural Minnesota communities, the key disruptors, and the recommendations for actions, policy, projects, and commitments that you contributed. And lastly, I'll be sharing with you a couple of questions just for you to think about and consider before we gather together again as a group. For those of you who are able to make it during our 1-hour meeting scheduled for Wednesday, August 12th at 9 a.m. Central. And if you don't have the opportunity, we would still love to hear from you. We've got a couple of questions that if you've got thoughts, we'd love for you to send them, and I'll talk more about that later. So let's take a little bit more detailed look at the overall project just to reorient you again to the study and your role in it. The purpose of this project, you probably remember, is to examine the trends and disruptors within the rural healthcare environment that influence access to quality, affordable care in rural Minnesota. And what the goal of what we're working to do in this study is to highlight and elevate rural health policy in Minnesota. We also are looking to encourage a framework approach to planning with information and data, to provide scenarios to be forward-thinking in a rapidly changing environment, and to identify options for rural health policy development. The audience for this project, those that we think will be interested and should be hearing about our findings and recommendations, include policymakers, business leaders, communities, and providers. Just a reminder that this project is funded by the Mayo Clinic Foundation, and with that funding, the National Rural Health Resource Center, which we refer to as the center, is partnering with the College of St. Scholastica to conduct this study. With this slide, we really want to highlight and recognize all of you. So it's not just these organizations that are partnering in this study, but we consider you, each individual participants, to be partners in this project as well. What we're developing would never be possible without your willingness to share your knowledge and your insights with us. And I also want to recognize the contribution of another partner organization, Stroudwater Associates. Stroudwater has been working as a partner with us at the center for many years, and we recognize their depth of knowledge in the area of rural healthcare finance. Stroudwater has made significant contributions to understanding and developing value-based financial models across the country. And Eric Schell and Dan Gibbon, who you see listed at the bottom of this slide, are currently in the process of developing a financial model for rural healthcare in Minnesota based on the results of our summit. I'll tell you a little bit more about it today, but they're continuing to work on it, and their detailed contribution will be included in our final report. So it's pretty easy to get lost in the complexity of this study. So here's a little map showing the path that we all took together as pre-work for the summit, and then during the summer in the summit, and in the follow-up work that you did. So throughout this presentation, I'll just share with you some highlights of this journey, but just to take a little trip around this map. So the place to start is up in the top left in the green box, which was where we started, which was understanding the here and now. So we spent some time studying the situation to identify what's been going on and what we're noticing in today's environment. The next step, which many of you know is critical to long-term planning, is to develop a shared vision, or to imagine what we want our healthcare system to be. When we did this in the summit, you may remember that we shifted our focus into the future. So we imagined out 10 years to 2030, and our task was to describe the way we want healthcare to function within our rural communities. For this part of the summit, we wanted to make sure to cover the entire state of Minnesota, and so we imagined the future of 4 different rural communities. This vision of health in rural Minnesota kind of acts like a beacon to draw us forward, so it gives us something to aim for as we make decisions and take action. Then with the clear vision in mind, kind of going to the bottom of this slide, the next step is to think about and anticipate specific trends that will either help us or hinder our effort as we reach toward our vision. So when we have our vision in mind and we've looked at anticipated trends, it's time to identify possible disruptors. And we've defined disruptors as those events, those circumstances and decisions that could influence or change those trends. And we asked you to consider the likelihood of these disruptors actually happening, and also the degree of impact they could have on the trends. So we asked you to predict the influence that the disruptors would have in changing the trajectory of the trends. And then with all that in mind, directly following the summit, you spent some time individually identifying specific recommendations that will ensure the disruptors do their disruptive jobs of impacting trends and aiming Minnesota toward this vision that we created in 2030. The project team has been analyzing the input and the insights that you shared with us at the summit, and with the next few slides, I'll share with you the summarized results that will be included in our project report and are being used to develop project models to better understand the recommendations that thought leaders across the state can use. So in the design of this project, we started with seeking to understand the here and now through a literature review. The project team did a literature review to identify trends and possible disruptors, and just to jumpstart thinking before the summit. And you spent some time looking through that literature review and thinking about it. There was an environmental data analysis looking at rural Minnesota and rural United States, looking at a variety of components to further guide our thinking. There were key informant interviews with rural community members to gain further insight on the community profiles. And then from all of that information, we created community profiles just to better see the possible impact of disruptors across the state. You did an amazing job with the homework. You all came really prepared to talk and share ideas at the summit. You dove into your assigned communities to understand in the here and now of that rural community that you were assigned, and meshing it with your own perspectives, which often can't come from a different part of the state than the community that you work on. And the results of this summit discussions on trends and disruptors really demonstrates your dedication to this work. So after spending some time understanding the here and now, you shared with us your insights describing what we imagine access to affordable quality care to look like in 2030. This step, as I mentioned, kind of acts as a beacon for us to be aiming for as ideas are transformed into projects and processes, and as decisions are made within a system as complex as healthcare. As our Stroudwater partners say, the way that we pay for healthcare is dependent on the function of the system and the form that's put in place to achieve that function. So translating to our summit design, our vision will inform the implementation of structure and processes, and that's what we're paying for. So some of the input that you provided as to what that vision looks like, what that 2030 view of healthcare looks like, some of the things that you identified as important to that vision were affordability for all community members, viable for the healthcare workforce, that the system focuses on both illness and wellness, whole person care, cradle to grave care, technology tools used to our advantage, care that was oriented around the community member, team-based care, seamless data sharing, a system that rewards good health and relies and emphasizes partnerships across sectors. So the next step in the design is to anticipate the trends of rural health in communities that will help or get in the way of our progress toward that vision. So remember that we defined a trend as a general direction in which something is continuing, developing, or changing. And on this slide is a summarized list of the anticipated trends that you identified as you consider the report outs from our 4 community profiles. So things like access to broadband, access to primary care, coalition activity, economic viability, focus on social determinants, high cost health insurance, increasing cost of healthcare, infrastructure challenges, low operating margins, multiple non-interoperable EHR systems, silos of stakeholders, and use of telehealth. The purpose of identifying these trends is to be proactive and deliberately shifting the trajectory of those trends in a direction that will help us achieve our vision. And that's where the role of disruptors comes in. So on the second day of the summit, after identifying the future we're aiming for and the trends that we want to influence, we spent time figuring out what we think will be disruptive to those trends. And this is where we really dive into the important work of finding what we can do to influence the future of rural health in Minnesota. Our design incorporates the ideas that by understanding disruptors as those events, happenings, activities, and decisions that influence trends, we're really increasing our awareness of the environment so we can be proactive in ensuring that the disruptors are working to help us achieve our vision. So that we leverage the disruptors to help us change the trajectory of trends in a way that helps create a healthcare system that allows for access to quality, affordable care. Here's a summary listing of the 6 key disruptors that were identified through your work in the summit. Our project team used syntax analysis in combination with our knowledge and experience within rural health environments to develop this listing. And we'll use the 6 disruptors to focus and to fine-tune our recommendations. So the 6 key disruptors that you identified were telehealth technology, payment, and regulations that enable providers to interact virtually with patients and community members. New technologies integrated into healthcare that supplant or support traditional care. The fact that consumers drive options to access healthcare using non-traditional avenues. Some increased attention on the vulnerability of the rural health system as exposed by the pandemic. Innovative rural population healthcare and payment models that ensure viable health services within rural communities and address financial pressures. And dramatic focused social investment with rural communities to address health disparities through social determinants of health and build community connections. These were the 6 key disruptors that came out of the summit. And we'll talk a little bit more about these in detail in the report. So identifying disruptors is a step in the right direction, but then in the summit, we asked you to share even more of your expertise and insights. So this may look familiar to you. It may have felt a little chaotic at the time. But what we asked you to do was assess the likelihood of the key disruptors as actually happening and the potential impact that each of those disruptors would have on access, quality, and affordability. You'll most likely recall that this was not very easy. Your responses were scored and the level of agreement was evaluated. So while it may have looked chaotic on the screen, there was a method to the madness, and we got some really interesting, good data from this. So in the next slide, you'll see the results in a summarized chart showing the overall ranking for each disruptor and the level of agreement of the ranking among participants. And your insights will help us better understand these disruptors and develop a response to each in order to get to our vision of health in 2030. So here's the summary. And when considering the likelihood of of each of these happening. You shared with us that telehealth, consumer-driven options, and population healthcare and payment models are the most likely disruptors to occur. And the one that you identified as the least likely to occur is the dramatic focused social investment, this one on the bottom. And with your insights to improve access to care in 2030, we're encouraged to focus on telehealth, consumer health care options, and social investments to improve consumer access to healthcare. That second set of columns on this chart. To have the most influence on affordability, what your insights told us was that we should be maybe focusing our work toward the use of new technologies. And although the disruptor of social investments was thought to have the greatest impact of quality, what you told us was you thought this was the least likely disruptor to occur. So this is something that we may explore a little bit more when we're together on August 12th. We'll ask for your thoughts about ways to increase the likelihood of disruptors that you feel are less likely to occur. And I'll talk a little bit more about this before we wrap up this webinar. After the summit concluded with your ideas about a vision for healthcare, critical trends and their disruptors to consider how to influence, you shared with us your recommendations. So those actions, policies, decisions, circumstances that will help Minnesota achieve the goal of access to quality, affordable care in 2030 and the 2030 vision for rural health. So we've been working to identify key themes across the more than 200 recommendations you provided. And we've identified 30 critical kind of overarching recommendations. And this slide shows just a little sneak peek at some of the key themes that we identified. We'll be sharing these with you in more detail when we're together on August 12th. And we'll ask for your review and your feedback on these themes at that time. And after you've had time to provide your feedback, we'll be finalizing the recommendations to include in our final report. So having gathered all this information and sorted out your many insights, the project team is really excited to think about the next question, which is what might actually happen within our rural communities and how will we know we're making progress? What are some of the milestones we can be watching for as we journey toward 2030? And to help us answer these questions, we're developing models based on the input that you've provided and adding in some of our expertise for selecting specific assumptions. So we're doing this in two different models. One model is considering the demographic, economic, and health outcomes information and assumptions. And a second model is considering financial information and assumptions of rural healthcare in Minnesota. All of the modeling begins by examining and looking at the future we're aiming for and then asks, what if? So what if we can help our disruptors do their jobs and shift the trajectory of the trends in a way that achieves our vision? For example, what if we had high-speed internet available to all rural Minnesota communities? What if we had strong collaboration for healthcare and social determinants of health? What if rural communities and providers had financial stability? What if no one's worried about how and when they receive the care that they need? And what if we have effective coordination of clinical and community care? So the next steps in our study are to ask these questions and to see if we can develop models that incorporate assumptions identified through our work so far. Our College of St. Scholastica partners are working on modeling the demographic and economic factors, and our Stroudwater partners are working on financial payment models and projections. So as I wrap up this update, I just want to pose a couple of questions for you to consider. If you're able to participate in our meeting on the 12th, we look forward to talking through these questions with you. And if you're not able to join us on the 12th, you're invited just to share your thoughts with it through an email or a phone call to either Sally Buck or Terry Hill, Cap Wilkes, or myself. And our contact information is at the end of this presentation. So the questions are, when considering that vision for 2030 as a vision, which elements are brighter and have a stronger pull? And of the 6 key disruptors, which ones are more likely to happen kind of organically or no matter what? And which ones may require more effort or could be influenced with some intentional action? So those are some things to think about before we meet, and we're very much looking forward to meeting with you on the 12th. So we've reserved an hour for our meeting at 9 a.m. Central. Your calendar invitation has the connection link and the agenda, and if it doesn't yet, it will shortly. An updated one will be sent. And before the meeting, we'll be sending you a draft of the recommendations and the documentation from this presentation with an invitation to share your feedback. So that's what's coming up in the very near future. So again, here's our contact information. I thank you very much for joining me today and watching this recording. If you have questions, if you have thoughts to share, please contact any of us. We would love to hear from you. And we very much look forward to seeing you on August 12th. Thank you very much.